Dr. Josie is with me today. I'm excited to talk to you about all things pets, vets, and anything in between. So welcome to the podcast.
Thank you. I'm so glad to be here.
I really want to start with your story. Like, I know you have your podcast, which is In the Vet's Office, and you talk all about all these different vet stories and stuff, which is so awesome. But how did you even become a vet? Where was that idea? Were you a kid and like, I have to do this, or just it happened in the right way that it needed to happen?
Yeah, I always grew up loving animals. Of course, I think any veterinarian will tell you that. Honestly, I grew up in a house where it was kind of tumultuous. I had a dad that really struggled with addiction. So he was in and out a lot, going to rehabs, like extended stay rehabs. And he was always against us having a dog. And then finally at one point he was gone one of the times. I think I was like 10 or 11. And my mom was like, screw it, we are getting a dog. And so we got a dog. Her name was Macy. She was actually a golden doodle before golden doodles were like even a thing, because this was probably 25 years ago. And I think that was my first time realizing like just how instrumental these animals are in our life. Like, of course, I was only 10, so I probably couldn't really grasp it, but I knew like this is unconditional love. They, are always there for you no matter what. And so it really became like this one family member that I could really depend on. And so for me, my love for animals really started there. And so a couple years later, I got a car, 2001 Toyota Camry, and her name was Sabrina. And my mom said, if you're going to have this car, you're going to have to pay for gas and maintenance, and you're going to need to get a job. And so the first place I put on my shoes and I walked down the street, and the first place I passed was a small, not that small, I guess. It's a pretty decent sized veterinary hospital in Indianapolis. Shout out Broad Ripple Animal Clinic. And I started working there in high school. When I was 15, I started working there.
Like front desk and helping with tasks, or something different?
No, I was a ward assistant, which means essentially I cleaned poop and I cleaned the kennels after the animals left. I would take care of them post-op. I did a lot of like restraining them for blood draws. So I was like bottom of the barrel, bottom of the totem pole. Grunt work, like high school grunt work, So yeah, that's where I started.
And you still kept deciding like, this is what I'm going to do. It didn't turn you away from wanting to do that.
No, I loved it. No, I remember thinking, I worked with this one veterinarian and he was amazing. And I just thought he could walk on water. And I was like, if I could be half the vet he is someday, like I will be so proud of myself. And so he actually went on to write me a letter of recommendation to vet school. And yeah, from there, you go. I will say, kind of going back to that, working in a clinic, I think is so important, because people do think, oh gosh, like being a vet is so glamorous. You work with kittens and puppies and fluffy animals. Like it must be the best job ever. But it's really tough sometimes. And so getting that exposure when I was little to, hey, like not every day is rainbows and butterflies, and you have to have difficult conversations, I think for me really helped me understand the profession. And I went in eyes wide open. So I think, if anyone's listening and they want to go to vet school, I would highly recommend getting that experience prior to.
It's kind of like with most things, I think, in life, where you should always try before you buy, or like try before you commit.
Yes.
It's everything in life. You should give it a shot before you fully like throw your whole self in. In some situations, it makes sense to throw your whole self in.
Yeah.
But majority of the time,
yes.
If you can try on something and see, how does this work? What looks like, is there things I'm missing? Is there pieces I don't understand? Every scenario, I feel like it benefits you.
Especially when it's 12 years of school and hundreds of thousands of dollars in student debt, you probably want to try it on before you buy it. So yes. I definitely agree to that. And I do think every job is sort of probably glamorized to some extent. Like I'm sure people are like, hey, she works on the radio. That must be so amazing. But of course, with any job, there's always, difficult parts of it.
Yes, you have highs and lows in every job, and it's much to that saying, everything isn't always greener on the other side.
Yes.
But something that's a hard part, I think, for vet work that a lot of people don't consider, you think, to your point, that it is rainbows and unicorns and you get to play with dogs and cats all day. If you love animals, that sounds like a dream. But you have to have very hard conversations all the time.
Yes, you do. And one thing I tell to anyone, because I'll have high schoolers or college students say, I want to be a vet. Like, what do you think? And I tell them, you need to have above average people skills. People don't realize, they think, oh, I love animals, I'll be an animal doctor so I don't have to deal with humans. But 75% of my job is working with the humans that own these animals and making them feel comfortable and reading their body language and communicating to them really tough news sometimes. And so that's a huge part of it. And in vet school, we aren't taught those soft skills really. So that's something that, you're either born with it or you work really hard and you get better at it, because they are communication skills you can learn. And then of course there's veterinarians that are research in a lab. So that's different. You probably don't have to have great people skills. But in my role, I spend a lot of time talking to humans.
Well, and I believe that makes a difference between a good vet and an exceptional one. Mm-hmm. Is genuinely like how you communicate, because especially with the experience I've had in the last 3 months, I have seen all kinds of different types of vets and how they operate.
Yeah.
And there's definitely some who are really exceptional at what they do, mm-hmm. and others where you're like, I could have really used a different scenario there.
Yeah.
That would have been helpful.
And I hate to stereotype this. Like, I don't want to say all really smart people are like this, but veterinarians are traditionally, like just categorically, very intelligent. You don't get into vet school unless you're highly intelligent. And so I find that a lot of highly intelligent people do kind of lack those softer people skills sometimes. Mm-hmm. And so finding the combination of both can be difficult for sure.
And because you do have to have such difficult conversations, mm-hmm. there is a reason why for veterinarians that the mental health suicide rate is really, really high. Mm-hmm. How do you handle that? How do you take care of yourself when this is such a huge part of your job that you're having to take it home with you a lot?
Yeah. Yeah, it's interesting. People don't realize, I think we're the highest profession, maybe us and dentists.
And you guys were, and I remember looking at that stat. I haven't seen the updated one, I guess, in the last year or so, but last I was reading the study about it, it was vets.
Yeah. And it's multifactorial. I think there's like a lot of things that go on, whether it's, we leave school with an exorbitant amount of debt, pretty much the same amount of debt as a human doctor. And then we get paid 1/8 of what a human doctor makes. And then owners get upset for whatever reason, rightfully so, probably because their pet's, sick, but then they say, oh, well, you're just out for money. So I think there's like this crazy cycle that goes on. And then too, like you said, having to have really difficult conversations. And a lot of times we have to let our patients go, even though we know we potentially could fix them. But let's say the owner doesn't have the finances to do so. So it can be taxing for sure. What I do personally is I'm really lucky. I have an amazing support system. My husband, who's been on my podcast, he's the best. He is so wonderful. I can talk to him about anything. And he's not in veterinary medicine, which I find is really helpful. He does joke that he probably could have an honorary vet degree at this point.
Probably.
Which I'm like, that is insulting. But also maybe a little true, because he says things I'm like, wow, like, damn, you could be a vet.
Hey, at least you also know that he's listening to you.
That's true.
That's true. This is important.
Silver lining. Yeah. Yeah. The other day we passed like a little French bulldog and he's like, ooh, look at that brachycephalic.
You're like, excuse me?
Excuse you? I have trained you so well. No, so he's a great source of a great outlet for me. And then my first job out was really grueling. I worked 12-hour shifts. I quickly realized 6 months in, I was like, this job, well, you'll think about all your cases when you get home. You'll live, eat, breathe, and die by this job. And I can't sustain that forever. So I have found hobbies that I love. I have a therapist that I talk to. I try to make sure I have balance.
Yeah, that's so important. And it is, you are putting so much time and effort. And I think another side of this is that you're working with animals who can't speak to you. And so you have owners who are speaking for them the best that they know how to do. And you're trying to speak the best that you know how to do on the anatomy side and understanding what's happening to them. And so it's this perfect storm of all of the things that could possibly be just the most mentally exhausting scenario.
Yeah. And the reality is, just like you said, they can't speak. So a lot of times I'm advocating for the animal. First and foremost, that is my job. I love my clients. Of course, I want to meet their expectations, but I will never jeopardize my patient's health or well-being. to make a client happy. So I have to advocate for them. And even if that means that the clients don't want to hear that, like that's just part of the job, which you're right, can be really difficult.
Mm-hmm. And I love that you have hobbies and stuff, but also isn't one of your hobbies involved in this also with animals? You ride horses.
I know. Yes. I can't escape animals, but they're my passion. So yes, I ride horses. That is like, a lot of people ask me, did you want to be a horse vet? And I said, no, this is like what I love to do outside of work. And I've been pretty like strict about that. So that has been a good thing.
And that stays that way. But you have horses too.
Yes. Correct? Yep. I have really primarily just my old horse. He's 25. His name is Timmy. Actually, is he 25? He was born in 2001. So yeah, he's turning 25.
Well, and horses can live a really long time. Yes. I don't know that anybody ever realizes that or considers that. I had 4 horses growing up and I adored them.
Yeah.
But they lived for so long.
Oh, a horse is a huge commitment. I don't think we have a problem for sure. People buy horses and then they're like, wait, this horse is going to live till 35, 40 and they're stuck with this horse. So then that's how you hear about the horse trade and the meat trade, and it's a slippery slope.
And don't get me into that because
we are not going to go there. I
have donated to so many horse rescues once I discovered this.
It's like that Sarah McLachlan commercial for horses that comes on.
Well, I never even knew about. I mean, I should have. I think there was a big naive side of me that
the average layperson, I would say majority of people listening to this podcast have no idea what we're talking about. But after this, you need to go Google the horse meat trade.
Yeah, maybe watch on TikTok. It may not be as gruesome, I guess. Yeah. It may allow you to go into it easily. Yeah. But it is like, you really think about, even there's somebody that I follow on Instagram. His name is Niall Harbison. I've had him on the podcast, and he created a dog rescue in Thailand, and you have all these street dogs that he takes care of. But he went to India, where there was this huge problem of like street dogs, where the whole government was about to kill all of these dogs, and he was down there to advocate. And there's so much culturally interesting things surrounding so many different animals and how we all value them differently.
Yes.
And then you just have people like us who I'm like, I value all of them. So like, how can we make that work?
You're like, I value the ant on the sidewalk. Yeah. So,
but I try and save spiders, and I hate spiders.
Yes.
It
is culturally. I mean, that's a great point. Like wherever you go in the world, their values and the way they view animals and their pets can be very different. And that doesn't make it any less right or wrong. It's just different from us. I will say, like, the horse trade though, to me is kind of black and white wrong, because it's abuse and neglect and unethical. So
it is very much so. And there's moments where I'll go down the rabbit hole and then I have to pull myself back up, because I get so sad. And then I'm like, okay, well, I guess whenever I finally get my farm one day, I'll be rescuing horses. So
5,000 horses later.
No, literally.
I know.
And I just love them. I think they're beautiful animals. So I love that that's your hobby and it's an escape, because they're also therapeutic.
Oh, 1,000,000%. Spending time around a horse, just even walking into the barn and smelling, this sounds gross, but the manure, the hay, the leather, I'm like, oh, this is the best. I'm immediately more calm.
Even with the manure?
I love the smell of horse poop. Put that on the pod. Don't even cut that out.
This makes so much more sense. Why, when you were such a young kid and you walked in, you were cleaning poop and you're like, yeah, this is fine. I still love this.
You're like, this girl's a weird. I mean, okay, I don't like smell the poop as it's coming out, but just like, the barn in general, like it's just the best smell in the world.
I know the smell you're talking about, but it's so much more fun to
say I like poop. Make me say it. I double down on it. I like the smell of poop. Not all poop, just horse poop.
Specifically horse poop. You really didn't. You didn't just double down. God. You tripled down.
Can you cut that?
No, that is staying in this podcast. Okay. I do want to talk to you because it's been such a grueling last few months for me. And I think a lot of pet owners experience this if they have their pets for a lifetime, which you should in 99.9 scenarios. The hardest part is that they age and they get older. Mm-hmm. And with that, just like when we age, things happen. And my cat Hazel was diagnosed with kidney disease. And a month later, my dog Remy was diagnosed with Addison's disease.
Yeah, you've been through it.
Which, as a pet owner, was incredibly hard. You mentioned advocating. I was advocating for 2 animals on 2 completely different spectrums, trying to understand 2 things. I had known a little bit about kidney disease and known that cats get it, but this is a completely new experience. Never in my life have I even heard about Addison's disease. So I felt completely just shut down, like I had failed. Mm-hmm. Do you feel like when you're going through this with so many different diagnoses and diseases, and you have patients that come in and they could have any number of things, and you experience these clients who just feel so helpless? And
yes, every day I feel that. I mean, I hope I don't make them feel that way, but I think it's just an inherent. These are your children and you love them and they're a part of your family and you would do anything for them, and they're sick. And that is a really hard thing to come to terms with. Also, Addison's, for example, we have to do some testing to figure out what's going on. So you're kind of in this limbo zone almost, and that's really challenging for owners. They want to know right away, what's wrong? What do we do to fix it? And unfortunately, sometimes I say we have to cast a wide net diagnostically to figure out what exactly is going on. So that sort of like waiting period is really hard, especially if your pet's really sick. Then they get diagnosed with this, Addison's as a somewhat complex disease. The treatment can be somewhat complex. And you're like, I am not a doctor. I do not understand what's going on here. So if you don't have a veterinarian that you like really trust and click with and they communicate well, you guys communicate well together, yes, it could be really challenging. I can definitely understand that.
Well, and that was the experience. So 2 different ones. Well, I'll focus on Hazel first. This is for all my cat lovers, so you can be very educated. Kidney disease happens to nearly all cats. It's more of a
super common
if than a win, or a win than an if.
If they live long enough. Hazel's how old?
She's about 10 roughly.
Okay. So she's on the younger side, I would say, but also she's Siamese. Yes. Which predisposes them a little bit.
And she's a rescue that came from a 130 cat hoarding situation I didn't get her until she was 8 years old. So for 8 years of her life, I have no idea.
I always forget that you've only had her for 2 years. Mm-hmm. So who knows?
And I don't know what her diet was like. I don't know what she was consuming. I have no idea.
Can't imagine it was good.
No, yeah. I cannot. And I'm sure that was not helpful to what her genes already are predisposed. Words are hard for me sometimes. Thank you. Yeah. That it just added to that complication. So when this all happening, it was like, there was a lot of like, yes, this was probably going to happen, but it was still this like shock to me, because now I have a cat who went from incredibly healthy. We had no issues. She ate super well. Everything was fine. To one day she has blood in her urine, and I'm like, okay, take her to the vet. She obviously has something going on. Mm-hmm. And then I have a cat that's hospitalized. It was like that quick.
Yes. Because
that's major. Yes. That's not supposed to be happening. And you do all these medications, and the kidney is so difficult to understand and what's happening with it, especially with cats.
I will say one thing you just said there that a lot of owners will resonate with, especially with cats, is 1 minute they're fine, the next they're not. Dogs are, I find, not all dogs, but most dogs are a little bit more different. Well, they'll be like, I don't feel so good today. Like you may notice a little bit more of a theme. Cats are like, no, I'm good. I'm dying. Mm-hmm. Like I think it's just because that's like their predatorial drive. Like they don't want to show weakness because they'll get eaten out in the wild. So they're tough.
They are. Mm-hmm. And thankfully, Hazel was pretty quick to show me signs. She stopped eating. She started hiding under the bed, which was unusual for her. She started giving that behavior within 24 hours. And I was like, something's up.
Totally.
So, but it was just crazy how I just had a perfectly healthy cat then all of a sudden my cat was hospitalized, not once, but twice. And this kidney infection was not going away. And then I'm sitting there and they're like talking about how, okay, well, she's probably in kidney failure. And I'm sitting there like, she was just healthy, and my whole like heart and my whole just face, and you could just feel it. Like the exhaustion was going over my body. Like, what does this mean? What does this look like? How much time do I have left? And thankfully we're now at a place where she's maybe stage 1, stage 2. We just, she's just got some really, as they call them, ugly kidneys, because much cats do.
You're like, hey, don't shame her kidneys.
They're not very pretty, poor girl. But now she gets sub-Q fluids twice a week, which...
Are you doing those?
Yeah.
Good for you.
Yeah.
How's that? Well, just for people listening, sub-Q fluids are just like you would see if you went to the hospital and we get IV fluids into our arm. The owners are able to stick the needle under the scruff, which is like that skin on their back.
Where like
neck.
the mom would pick them up.
Exactly. Yes. So they don't have a lot of nerve endings there. But then owners will stick a little needle in and give them fluids that way, which then gets absorbed into the bloodstream. And with kidney disease, keeping them hydrated is far and away like the number one thing that we focus on. So how's that going for you?
It's been a challenge.
I bet. Especially if she's wiggly.
And she normally isn't, but like when we go to the vet, she makes it look like nothing's happening. We do it here, and you would think that there's an all-out war happening at my house.
Are we like hissing, swatting?
Well, thankfully, Miss Hazel doesn't have any teeth, so she gives love bites, but they're gummy love bites.
Bless her heart.
So she's trying. It's just not going anywhere. So we've got a lot of learning curve that we've finally passed. It's funny because I tell my boyfriend, I'm like, I know that I would have been able to do this because I would have found a way by myself. I just would have.
Yeah.
But I'm so glad I didn't have to, because I faint when it comes to needles and stuff.
Oh my gosh.
Like there was one time I was holding her and I'm like clutching her, right? And I know not to keep my legs straight because I will faint. And I'm like holding on and he's putting the needle in and we're like, I don't know, 30 milliliters in. And I'm like, deep breath.
I'm going down.
And I think we only got like 60 in her that day because she felt my energy and it was not good. And she like goes crazy. She runs away and I just like flop into the kitchen floor and I was like, I'm about to pass out.
Honestly though, like it's scary. Like poking yourself, of course, awful, but poking your cat, your sweet, precious cat.
Yeah. And she's so sweet and docile.
She is.
Like my boyfriend was like, I don't want to hurt her. I feel like I'm hurting her.
It's awful.
And so it's been this, and it's very much the testament of I will do anything for them to care for them and give them the best life possible as long as they want to give me. But holy crap, like I really underestimated what this lifestyle change was going to look like.
Yeah. And also, I guess too, they're kind of aging at the same time. So you've got the double whammy.
Yes.
But I find that's kind of how life happens, when it rains, it pours situation. So it is really hard though, especially with our animals. I'm fostering. Well, I just adopted him. I foster failed. And this dog needed to have 24 teeth pulled, which I'm like, of course, like I know this, his teeth are infected. They need to come out. I do it. And then he's so miserable and in so much pain afterwards, even with all the pain meds. And I'm like, I feel so guilty, even though, and I'm a vet and I know that this is the right thing to do. So it's hard.
Well, and dental disease is such a big common cause for so many other things to happen. And that's why it's funny. We kind of bonded over the first time whenever you came on the show. Cause I was like, I brush my dog's teeth every single night. And you were like, yes.
I'm like, thank you. Bobby's like, what? I've never brushed a dog tooth in my life. I'm like, you are my worst client.
Yep.
Yeah. No, I love that.
And it is because to my knowledge, huge. Dental is so important to a pet's health.
So important. They don't have hands. So everything they do, what they pick up with their mouth, they eat with their mouth. I mean, yeah, and they can't, like they said, they are pretty darn stoic. So this little dog had 24 infected teeth. We have one infected tooth and we're running to the dentist.
Yeah. And that poor dog had 24. I do want to hear about this new adoption.
Yeah.
I do also want to acknowledge that you did lose also one of your beautiful dogs.
Yes. So we lost Biggie back in the spring. And he was this little brown, honestly, he was a terror, but I loved him. He bit Bobby. I don't know if you know that, but he bit him.
But this is also the same dog that you rescued from Mexico. Is this correct? Or is this the other one?
Saya.
Okay.
This is the one, he was from Proverbs, which is a rescue here in town.
That's the one I've fostered through before. Okay.
Yes. Yeah. Biggie was my little terror. He loved his mom and really nobody else. And that, honestly, loved that. I'm like,
small dog syndrome.
Exactly.
Mm-hmm.
So then Wags calls me, I don't know, maybe a month ago. And they're like, we have another little brown dog. And I'm like, is this weird that I'm just like, am I like trying to reincarnate Biggie? But then I met this little guy. His name is Duke. He's a little Pekingese. I think
they do look similar. Similar breeds at all?
No, Duke is full 100% Pekingese. And Biggie was like a super mutt of like Chihuahua, Beagle, something else. Yeah, I don't even think he had Pekingese in him. They're just small and brown and like decrepit.
Similar.
I know. I'm like, Cody, are people going to think I'm like trying to, am I weird for doing this?
No, not at all.
You fall in love with. So Yeah. So Duke is the second we brought him home. We were like, oh, we love this dog. He's really sweet. Cody, as I'm sure you've seen on the internet, he's calling him Dookie, which I'm like, it's a turd. We might as well call him Turd.
You're like, this is not an appropriate name for this dog. That's so adorable.
Yeah, I'm like Dookie, but whatever. Now it's sticking. So now I'm calling him Dookie. My friends are calling him Dookie. So Dookie is here to stay.
You know, when you initially said it, because I knew his name was Duke, it sounded like a nickname.
Yeah.
And then when you associated it then with it, then I was like, okay, yeah, that's what that means. But at first I didn't.
Yeah. Okay, good.
So
that makes me feel
helps.
better. Like when we're outside and the neighbors hear us going, Dookie, they're not going to think we're crazy.
No. Okay. Also, if you're still using Dookie today, then you might be from like
that's
the
true.
60s.
You know what? Yeah, that's true.
So we don't exactly use that word much anymore.
Yeah,
I think you're safe.
Okay, good. That's good to know. But yeah, he's great. He's sleeping in bed with us. He is fully acclimated into our life now.
Okay. And so when he first came in, I know you were like, okay, we're fostering. That's all we're doing. This is what's happening.
Yeah.
When did the changeover happen?
I think I was telling myself that because I really was not trying to adopt a senior dog. As you know, they come with lots of issues. Heartbreak is imminent. Mm-hmm. And I had just lost Biggie. So I'm like, well, why would I do this to myself? But then, you know, they come into your life and he's so stinking cute and he fit in perfectly with my other two dogs. I think for us, it was like 24 hours after him being home. We were like, okay, yep, he's staying.
You guys knew.
So
you were still posting a little bit on social media that you were looking for a family, but you really weren't.
I was like, well, let me see if we have any takers, you know? I'm still trying to like keep it alive, but I know at that point, like it's like, I knew in my heart he was staying with us.
It's really hard. I've always said, like, when I've been fostering.
Yeah, you foster. You're good at it.
Well,
I cannot. Clearly.
Trust me, that you want to talk about like something that's a learned thing. You definitely have to learn over time, and you learn to handle the heartbreak a little bit easier each time. But I'm also really lucky in the sense that Remy is very particular about what she wants to be around. She can handle and tolerate a lot of things. Yeah. But for a forever situation, not so much. So I had always said if I found a dog that was like a really good fit with her and Hazel, which is hard, a dog and a cat, that would probably be the moment. Mm-hmm. But that hasn't happened.
You know, that's very female dog of her.
Really?
Mm-hmm, definitely. I find that majority, and now this may not be true for every dog, but majority of female dogs are very particular. They're loving, they're sweet, they're kind, they're great, they're easygoing, but they can be very particular.
Interesting.
And boy dogs are just a little bit more like, well, whatever goes, you know, like they're just kind of more dopey.
Is that like an acronym for
and
real
I
life?
do think that this translates to humans.
You say that out loud, and I was like, I feel like there are some connections there.
It totally rings true though with animals as well. Well, at least with dogs.
That's wild.
Mm-hmm. And horses.
Oh yeah.
Yeah.
Horses though, in general, are they just more particular though? Or is it?
No, I mean, mares, female horses are exponentially more particular than geldings, which are castrated horses.
I never realized they were called geldings.
Geldings, yeah.
Geldings.
Yeah. Uh-huh. That's a boy horse that has, well, we call it neuter in dogs, but castrated in a horse.
I did know about castration because it always threw me off. I was like, we're still using the word. That's another word where I'm like, I don't feel like we should be using that word anymore.
It sounds really barbaric. Castration. Yes.
Yeah. Okay. Well, I just learned another new thing today. Yeah. I did know mares.
Yeah.
And maybe for also my naive side, because we had all mares growing up, that I, for some reason, thought, okay, well, boy horses are also the same name or something.
Totally. No, yeah. Geldings and mares, and geldings are dopes compared to mares. Dopes. Dope. Like they're like dopey.
I like the dopey. I do call golden retrievers are dopey dogs.
Oh yeah, totally.
And like Remy to me is an Eeyore dog, where she just kind of like walks and like life is moving very slow.
Yeah.
And then there's like dopey dogs. I've started to like categorize
for sure.
Different types.
I meet other dogs that they're like looking at, like they look into your soul and they know. Mm-hmm. And then I have other ones that are like lights out, no one's home. They're just like, let's party. So there's, totally two different kinds.
What other comparison do you see between animals and humans? You've worked with so many animals and you're obviously a people person, but like we just talked about how females, males, but is there other comparisons where you're like, dang, I don't know that people realize this?
I think another big one is their like tolerance for pain or drama. Like I have some patients where I'm like, you're so dramatic. Like my own German Shepherd, for example, will stub his toe and he will scream bloody murder. I have another little patient. I go to pick her up and she just starts screaming. I'm like, what? Nothing's even happened. And then you have others that are like Hazel, your cat, or, you know, probably Remy too. Like they're very stoic. They have a higher pain tolerance. They're like not as dramatic. So probably similar to humans.
Just emotions wise. Do you feel like they go through similar emotions to us?
I don't know. I think that's a interesting question. I don't think they have like I don't know. I mean, they certainly don't have the cognitive abilities that we do, but I do think they experience, you know, sadness and happiness. And I don't know if their memory is the same as ours, but they do remember like traumatic experiences, and that can really like shape their personality. So I think to some extent, yes.
Well, and it's funny you mentioned memory too, because I had also seen an article come out about how dogs in particular often mimic some of their owners' like illnesses and sicknesses. Mm-hmm. And I've heard of dogs getting dementia. I've heard of dogs having these things that you would typically associate with humans.
Yeah.
Is that pretty true? Do you see that happen?
I don't know. I don't think there's enough data behind that. I think it's all anecdotal, and maybe that's true. I will say without a doubt, animals will have the same energy as their owners a lot of times. So if owners are super stressed or anxious, then I find that their pets tend to be a little bit more stressed and anxious. So I definitely like the energy is for sure very similar between that of the owner and the pet.
It is funny too you say that, because I always say, like, if you want to know who a person is and they have an animal, what is their animal's personality like? Yeah. Because most of the time those animals are mimicking what their owners are doing.
I wonder what people thought when I had Biggie and he tried to bite everyone.
Like, just Josie just Josie's go around biting everybody. Is she a vampire?
She's awful.
Maybe though, you're particular about who you let in your circle.
Yeah, exactly.
And it's stuff like that.
Yeah.
I do think they pick up on things.
Oh, I for sure do.
And
I for sure.
That like personality type. I had one friend who she adopted a Cavapoo. Well, she bought a Cavapoo because of Remy. And I said, just FYI, rescues buying, they're much different. So I don't know that you're going to get the same thing, one. And two, your energy is a lot different than my energy. Mm-hmm. Just a warning. And sure enough, I mean, that sweet dog, she's so stinking cute, but she bounces off the walls and she's a little bit more anxious and stuff. And I was like, girlfriend, that dog is feeding off of you. This is where that is. She's like, but Remy is so calm. I was like, well, I tend to be pretty calm.
Remy is literally snoring in the corner right now.
Yeah, cannot be bothered by this interview.
She's perfect. I love this dog.
Oh, yes.
Do you know she's full Cavapoo?
So when I did a DNA test on Remy, she is the actual thing is she's mostly Cavalier Poodle, but she has 12% Chihuahua also.
My favorite breed.
Is that your favorite breed, or are you being sarcastic?
I love Chihuahuas. No, really? I love them. Oh yeah, I love them.
Even though they're little ankle biters is what they're known for.
I adore them. To own a Chihuahua and to be loved by a Chihuahua, there is nothing like it. I live and swear by Chihuahuas.
Okay, give me your 5 dog breeds that you would own.
That I would own.
Yeah.
Okay, if I was going to go to a breeder, which by the way, you can find purebreds and rescue.
I also agree. 100% signed statement.
Yeah. What purebreds would I own? I do really love golden retrievers. I love Labrador retrievers. That's like pretty classic. I love Chihuahuas. That's number 1 on the list for me. What other breeds do I love? I really like boxers.
Oh, boxers are so cute.
They're super cute. They've got like kind of goofy personalities, which I love.
Mm-hmm. They have that derpiness. Not as dopey, but they're derpy.
They are derpy, and I love it. I just want to like grab their jowls. And then I think if you like small dogs, I really like Malteses. That's a great little breed that they tend to be awesome little dogs.
We had a Maltese growing up.
Oh, I have one other that I always forget. Standard poodles are amazing.
Very smart.
Oh my gosh, smart. They're calm. They're regal. They're like perfect gentlemen or ladies. They are awesome. I love standard poodles. People go and buy doodles and I'm like, oh my gosh, don't buy a doodle. Get a standard poodle.
They're about the same size as a doodle, aren't they?
Yeah.
And they are really intelligent.
And I prefer their personalities. I think they're amazing.
Aren't they a little bit more stoic? Tend to be a little bit more stoic.
Yeah.
And
they're just not as like, we're finding more and more that doodles as they're getting bred, they're becoming like a little bit more hyperactive. Like some would even say some of them are neurotic, honestly. And I know I probably have a lot of doodle listeners out there, so please don't come for me, but we are just finding that for whatever reason, that gene of them being bred and being sort of hyperactive is becoming more prevalent.
That's interesting. I wonder where that's coming from in that whole line of genetics.
Yeah. I don't know. I mean, golden retrievers can be very overactive. I mean, any golden owner will tell you, like, if you get a good golden, amazing, best dog ever. If you get a bad golden, they are crazy.
Very high energy.
Yeah, exactly. So maybe somewhere in there that's gotten mixed in with it. So,
you know, there's one a breed that I never knew. And my sister got both of these from rescues and she had fallen in love with this breed, but Dobermans.
Dobies are great.
They're little Velcro dogs.
Yes.
They're not little by any means, but they're Velcro dogs and they are so stinking precious.
They are. Dobies are great. I mean, obviously that's a big dog. They can have some like protective tendencies. So you want to make sure you train them starting off very young age. Same with like our German Shepherds and our Malinois. But I do love Dobies a lot.
They are. And I just never really knew much about the breed until she got him because it was definitely one of those that was a standout that everybody always saw as a scary dog.
Yeah, no.
And they are just little angels.
No, they're amazing. Yeah, no, love them. I've never had a, knock on wood, but I like have my breeds where I'm like, oh yeah, they're going to try and eat me in the exam room. And the Dobies don't really make it onto that list for me.
Oh, see, there we go.
Yeah.
And it's that mischaracterized where we just really stereotype animals. We stereotype in humans. We do the same thing to animals.
Exactly. And Dobies are usually in the movies or the ones like protecting the backyard, like running after the bad guy. But no, they're very sweet.
Are Dalmatians very mean?
Dalmatians can be very aggressive.
Okay, so 101 Dalmatians, choosing them was an accurate representation.
Correct. A Dalmatian would be at the top, one of the top of my list for it might eat me in the exam room.
Really? What are the other ones?
Chihuahuas.
So Chihuahuas are number one on your
Chihuahuas will for
list.
sure try to bite me. Rottweilers can be up there. What other breed? I don't want to like stereotype breeds, but yeah, I mean, I guess that would be probably German Shepherds sometimes can be a little, and I have a German Shepherd, but they can just be, protective of their owner.
Well, and I've always said this too about animals in general. Now, if you get a rescue, it's a little bit more complicated because you never know their history completely. But if a dog is bad, regardless of breed, it is bad because of the owner, not because of the dog.
100%.
And
say it for the people in the back.
That is my asterisk to us talking about this. It's just more openly because you see so many types that if you are going to a shelter and you're like, oh, well, there's these breeds, it's great to be informed about what you're getting.
Yes, definitely. And not just because something looks cool or badass, like doesn't mean it's going to fit your lifestyle, because I see so many young single guys that go out and get Belgian Malinois or a German Shepherd, and then they don't have any fundamental training and they don't have the resources to take them to a trainer, and they're like, it's a disaster. So
especially Belgian Malinois. I see them all the time on social media, and holy crap, those dogs are awesome, but
amazing.
You have to know what you are doing.
They are freak of nature athletes. They can climb trees. They jump out of helicopters. I mean, they are next level. And if you don't train them, they're going to train you.
Yeah.
They're so smart.
That's one of those. That might be the only dog where I'm like, I'm not sure how. I'm such a lovey-dovey type trainee that like I will shower you with love and affection and positive reinforcement that a Belgian Malinois would train me.
They don't care. They're like, give me a toy. Let's go. I want my ball. I want this. I want that. Like they're like super demanding.
Yes. I do want to talk to you about Remy and Addison's disease because I've gotten so many questions about her. So I have been seeing a little bit more frequently that more dogs are getting Addison's disease. Is this just because we now know more about it?
Yeah, the prevalence of Addison's disease is not increasing. I think we as a profession are able to diagnose it a little bit more readily. Like we have the tests available to us. Owners are getting pet insurance and can afford it because, as you know, it is not inexpensive to diagnose Addison's disease. And Addison's is really kind of what we call the great impersonator. So it can look like a lot of different things. Like maybe they're throwing up a little, maybe they're having diarrhea, maybe they don't want to eat, maybe they're like just a little bit more lethargic, which a million things can cause that. So we really, like I said, we have to cast a wide net. There's one test in particular that can rule out Addison's, but if that comes back abnormal, then we have to do a confirmatory test. And a lot of times people may either tap out of finances, the pet's older, and they end up euthanizing and we never get to a full diagnosis. So I think we're just diagnosing it more as a profession.
Okay. And that makes a lot more sense. I think that comes with the even human medicine too, where we just start to understand things a lot better.
Yeah.
And that was the case for Remy. And if anybody ever sees it, like the biggest thing that I've realized between Hazel and Remy is that I am their liaison of getting healthy. Yes. And it is my job when I see a sign in them or see something to get them the help that they need.
100%. I tell my owners, you know your pet better than anybody. If you're telling me your pet is sick and acting off, like I'm going to trust you and we're going to figure it out. So, but you have to be, watching them and then, advocating for them as the owner.
Well, and that's so difficult too, because life can be hard, right? And I'm really lucky that Remy and I have a very special bond that the immediate moment she started being off, I was like, something is not normal here. And her signs were a little unusual. Her whole body was shaking, which was not normal for her. She started drinking more water. Remy hates drinking water. So I knew that was something. And then she started to get to the point where she wasn't eating near as much. And she is a very food motivated dog. So all three signs were pointing to me, something's not right. Took her into a vet. He's like, well, some of these signs can be Cushing's. It can also be another thing, but we need to get blood work to be sure. We get blood work. It comes back. All of her electrolytes were high. That's how this started. And he was like, okay, actually opposite side, Addison's disease. And that afternoon, because I know at this point something is wrong with her and she's not doing well. And I was like, I'm not going to sit here and wait. I'm not going to we're not going to keep pushing me away. Like we're coming in today and do the gold standard test, which is what you're talking about. The gold standard test, I had to leave Remy at the vet for about 30 minutes, an hour, because they pull it and they're measuring cortisol and
exactly. Yeah. It's an hour. We draw blood, then we give them an injection of a medication, and then we draw blood an hour after that.
Yeah. And so that particular vet visit, Remy's never been left at the vet awake. So as we leave the vet from that, which we're going to get the results the next morning, maybe an hour later, Remy starts trying to throw up. She has diarrhea blood, and she gets a little bit lethargic. And I was like, but as soon as I saw the diarrhea and blood, I was like, I don't care. It's 5 o'clock. We're going to the ER. There was no question in my mind. I was like, this has definitely gotten much worse in this span. And they pulled like her cortisol levels. And sure enough, she was very low. And she was at the beginning of an Addisonian crisis.
Yes. That's a scary thing about Addison's. If left undiagnosed, they can go into a full crisis where their organs start to shut down and they are life-threatening sick and need to be hospitalized.
And which, again, all of these things I didn't know. So all of this was like education for me, hopefully education for you to watch symptoms and signs. And I just got super lucky that in that time frame, I was able to get the diagnosis that I was and confirmed that she was Addison's. And I was watching her so closely that I got her in immediately as I noticed. And the vet looked at me and was like, you saved her life.
You did. 100%.
And I wanted to cry. I was already crying because of everything that was happening.
Of course.
But that was like a proud pet parent moment where I was like,
should be proud.
I recognized it.
Yeah. In your gut, and maybe it's women's intuition or a pet owner's intuition, because there's great male owners out there too, where it's my pet needs help. And so you advocating for a 1000% saved her life. I don't think she probably would have made it through the night.
I know. And that was like, and it was hard, right? Because to your point, finances, and it's expensive and you have to make tough decisions. But in that moment, I really wasn't thinking. I was just like, something that I was very proud and very happy that my parents did for me when I first adopted Remy 10 years ago was, if you're going to adopt a dog, you have to start saving money for that dog.
100%.
Because one day, maybe not now, maybe not 5 years from now, but one day you will need this money.
Correct.
And every, paycheck, I've socked away some money and planned and been ready for this. And so when that moment came, I could just say, okay, I'm ready. Take care of my dog.
Yeah. One thing too, I think for listeners to keep in mind is a lot of people are electing pet insurance now. A lot of people ask me about it, and probably back when you got her, it was not as prevalent, but it is becoming more prevalent today. And I strongly, strongly recommend pet insurance for situations just like this, like where you could have been putting money money away for a savings that could have gone to her pet insurance, which probably would have covered her hospital stay. Again, 10 years ago, I'm not even sure if we really had great pet insurance, but now it's getting so much better. And so if you're going to get a pet, the second you get them, get pet insurance before you even go to the vet, because the first time they're diagnosed with anything, that's a pre-existing condition.
Yep.
So,
and that's where I got stuck was, well, now they're both diagnosed.
now it's too late.
I can't do anything about that. But yes, please do that, because that will help save you financially, and gosh, just hospital bills and stuff in general then you don't have to make tough calls.
Exactly. It makes everyone's life easier. You don't have to decide, do I need to like take a mortgage out on my house versus, saving my pet's life? Mm-hmm. So
yeah. And now, and you can speak to this, like now Remy with Addison's is their adrenals failed. Mm-hmm. Her adrenals don't work anymore. So her body doesn't handle stress. So she has to get a monthly cortisol shot. She has to be on steroids every single day, which was also an adjustment period because we had to figure out what levels she liked. Yep. Her body worked, which was also just lifestyle changes in general too. So that is something to look out for. I mean, when your pet does get diagnosed with things, I think there's an acceptance and understanding that your life might change a little bit.
Yes. It can be, you are a caretaker at that point, right? You've got to drive them to their appointments. They have to get, with Addison's disease, their blood drawn quite a bit. They need injections, they need medications. And so, it's another very large responsibility as an owner being their caretaker. There is something called caretaker fatigue as well, which, you've got this little being that you love so much. And it's like, it can be taxing to have to take care of them. I'm sure they have that in human medicine. Mm-hmm. But yeah, we see it all the time in animal medicine. Well, thanks for speaking to that. I know a lot of people reach out to me saying they either were dealing with a period of their lives or they have similar situations with their pets. And there's so much that we don't talk about when it comes to pets aging. Mm-hmm. And I'm getting a very front seat to the whole experience. Yeah. Not that I wasn't ever prepared for. I had all of my other like family pets and stuff through their whole life, but my parents took care of it. This is the first time this is my responsibility. Yeah. And it's been a eye-opening experience that I wish I could even preach more. Like, pets are for a lifetime commitment. Like, you have to know what you're getting yourself into. 100%. And there's so much that you just have to be prepared for, to do and make calls and be the parent, actually. Yeah, you are there. They are your full-time responsibility. And that is easy when they're happy and healthy, but when they're sick, you really recognize the weight of that. Well, and I want to talk to you now about some hot topics on social media regarding pets. Okay. Of course. Let's do it. Speaking of that, like full-time care and just everything that I'm in, and you mention it too, you're like, these are your babies. Do you think animals can be called like, and parents, like, I'm a dog mom, I'm a cat mom, or like, that's my baby. Like, is that, in your veterinary opinion, okay to say like, this is my baby? Yeah. Or like, I'm a dog mom. Like, I'm a mom. I have a dog. I don't know. I feel like if a mom is listening to this who has human children, she's going to be like, you're right. Like, did you push that thing out of your vagina? I don't know. Like, are you actually, I think you're a mom. Yes. I think that love, and you love them like a child. I think you're a dog mom. Let's put it that way. I don't know if you're like the same as a human mom. I don't know. That's what's funny. What do you think? It's such a debate on social media. And I haven't come across this yet. Oh, it's so funny to watch because people have very strong opinions about this. More so because, and it's funny, you have people who've never pushed a child out ever who have a lot of strong opinions. Yeah. And truly the only one who can make that call is someone who has pushed a child out and who has dogs. Correct. That's the only one who's ever going to be able to truly weigh in on the situation. Exactly. But all that to be said, I think when you do care for a living being and you keep it alive and you watch for its needs, you are a parent. Yes, I agree with that. You're a pet parent. Yeah. I will say I'm the last of like pretty much all my friends to have babies. And I always ask my girlfriends, especially like the ones that love their dogs the way I do. Once they have the baby, I'm like, do you like still love your dog as much? Like, do you love your baby more? Like, I need to know. And they all say it's very different when you have a human baby. Really? Mm-hmm. Even the ones that are like us, diehard pet parents. And there's a change that happens. Yeah, there's a change. If I have a baby, I'll report back to you. Does that scare you because you haven't had any kids yet? And I don't know your choice and whatever you want to do, but
Does that scare you? Because that like scares me to think that one day if I do have kids, like I'm not going to be the pet parent that I was.
I don't think you love them any less is what I hear. I think it's just different. Like you just have this other little being that's a reflection of you that you love just maybe a little bit more. Does it scare me? I don't know. I guess maybe a little. I love my dogs. I love my dogs. Like there is nothing I wouldn't do for them. And I think it will still be that way for me. But maybe your heart grows a little bit even more. That's the way I like to think of it.
I like that concept a lot better because the idea of like any of that changing makes me really sad.
We will not love our pets any less. I can guarantee you that. I think it will just be different.
Yeah. Well, my sister's also, speaking of like, buy this out, she's going to have her first baby. She's currently in labor as we are recording this or about to go into labor.
Congrats.
And they have 4 dogs. They have 2 doodles and 2 Dobermans.
Does she love her dogs as much as we do?
Adores them.
Okay,
yes.
So she'll be a good metric.
And she was so excited to be a mom. So like I truly will have a full read on situation wise.
100%. Please let me know.
I will. Is that something like you look at your life and like what are the things that you still hope to accomplish? Because you have already accomplished so much. Yeah. But what are some things you still hope to do?
I do want to be a mom to humans, just to clarify. I think that we definitely want to have kids at some point. So that is on the docket. And then what do I want to accomplish? I mean, I had a really big, this last year was very transformative for me. I owned 2 clinics in downtown Nashville. I had 30 employees. I woke up one day and all I was doing was managing humans and I wasn't really doing a lot with animals. And I was like, this is not what makes my heart sing. And so I ended up selling my shares in those clinics. And now I have a very small concierge practice where I go to people's homes. It's just my nurse and I that drive around the city and I get to spend my time really taking care of animals and the people that love them. And so that for me has been so rewarding. And I think just focusing on that and nurturing that and growing that is going to be my big goal.
I love that. And it's not this is something that's new. Concierge Vets is very, very new.
Brand new.
And tell me why you decided like this was the next step for you, because there might be other people who are looking at different options or just also trying to figure out what, especially as their pets age, what that can look like.
To be fair, I was burnt out of clinical practice. I mean, I said, I have balance and I have hobbies and I have a therapist and all these things, but still I was exhausted being, there from 8 to 6 every day, managing people, seeing appointments. And I just knew I had to really sit down and reflect, okay, like I said, what makes my heart sing? What do I love to do? And for me, I love to take care of animals and I do love to take care of their owners as well. Some people in the profession, as we talked about, they don't like having to call owners back with blood work and they don't want to have those hard conversations. I really enjoy doing that and I really connect with clients. And so for me, I just tried to figure out how can I make my life a little bit more balanced, but be able to do the things that I love. And so there are a lot of humans on the medicine side, the human medicine side that are doing concierge medicine because of the benefits of it, the work-life balance. They don't have to take on as many patients and clients. And I thought, well, why don't I bring that to veterinary medicine? It hasn't been done before. I don't know of another concierge practice in the world.
The only thing I've ever heard of is like the in-home euthanasia stuff. Yeah. But that's the most I've really ever heard of at-home care.
Yeah, exactly. And there's mobile vets that go around, but I'm locked in. You have my cell phone number. You can call me at Friday at 6. I'm going to have meds dropped at your door. I know your pet's medical records like the back of my hand. So, I don't have to take on as many patients, which is really nice, but I still, get to take care of animals and they're the people that love them.
Do you put a limit on yourself of how many patients you can have at a time?
I think we're a year in and I'm starting to just start to feel that limit. I'm like, oh gosh, I'm feeling really busy. And a lot of people that are in the concierge practice have pets that have chronic issues or are aging or they have 5 dogs. So they require a lot of a time and attention, which is why I'm here. That's what I love to do and I'm happy to do it. But I'm like, I think I might need to cap myself. I'm finding myself very, very busy.
Well, and learning a lot of things of just you're starting in a different path that nobody's taken before. So what does that look like? And how are you going to manage it and still have your work-life balance, which was the whole purpose?
Exactly. So it's a learning exercise, and I'm sort of just taking it one day at a time, checking in with myself, my husband, and making sure that I'm, still feel like I have a balance. I am such an achiever. You don't go to vet school unless you are. So I'm like, of course I can take on 10 more clients, but I think I'm getting to the point where I'm like, let me think twice about this.
Let me really make sure.
Maybe I need to bring on another vet. We'll see what happens.
Well, I love this for you. And I love that. There was another social media question that I wanted to ask you about.
Let's hear it.
Everybody loves to see fat little floofs, like little cats that are so fluffy and large, or dogs that are a little chunky. And I would love your take on this, because I know as a pet owner how I feel, but I want to know your take as a veterinarian.
About pets being overweight.
Yes.
75% of pets that I see are overweight. And that is one thing. People always say, how can I make my pet live as long as possible? That is one thing I can say without fail. Having your pet at a healthy weight will increase its lifespan, unless something like terrible happens. But that's the one thing that we have in our control that we know creates a better life for them. It's better for their joints, their heart health, their overall systemic health. Like, they will live longer because fat cells are inflammatory. Now, when I tell owners that their pets are overweight, that has to be done very delicately. I can't be like, hello, your dog is fat. I have to be like, because they immediately take that as I've done something wrong. It can turn south very quickly. So it's a way that has to be collaborative, and we have to come up with a Weight Watchers plan together, and everyone in the home has to buy in. A lot of people have toddlers and they're throwing snacks over the table. And so it's a whole family commitment. But yeah, I mean, do I think fat pets are cute? Absolutely. I love a little roly-poly. Am I like, oh my God, my vet brain is like, no, this is bad. Yes, of course. And there are some pets that are really hard, especially cats. Fat cats are really hard to get to lose weight. So I do understand the challenge of being an owner with an overweight pet and like the challenge that comes with that. But I would definitely urge you, talk to your veterinarian, come up with a Weight Watchers plan, and try your best to stick to it, because we know that will lengthen their lifespan.
I love that you're calling it a Weight Watchers plan. Like, yes. You have to get them on these diets.
I make them do weigh-ins. Oh, we do the whole thing. I'm like Jenny Craig out here. I'm like,
what did you have? What is the
this
food
many calories?
agenda?
Yeah, because it's hard. And also people will be like, how much did you feed? Well, a scoop. I'm like, well, how much is a scoop? Because that could be like a red Solo cup, or it could be like a beer stein. Like we gotta nail it down to each little kibble.
Mm-hmm. And very much so. I mean, heck, my dog gets fed 3 times a day. And mind you, her thing is allocated to 3 times a day because she's a food hound.
Yeah.
But she doesn't know that she's still getting her intake. It's just in 3 doses, right, essentially. But what's funny about her is, like, by the end of the day, she will come and look at me like, oh, you didn't feed me at all.
Oh no. And that's the hardest part. Like, Biggie he would have eaten himself into the grave. If I would have let him go, he would have eaten himself to death. And he would still look at me like, oh, I'm starving. And you're like, I love you. You're so cute. I want to give you a treat. But you have to, like, humans out there listening to this, you have to have self-control. It's really hard, but you do.
Well, and I often go back and forth between it. I want you to live forever, and also I want your life to be as amazing as you want it to be.
Exactly.
So I want to give you what you want to try.
It's such a balance. And to be fair, you can work with your vet to find a plan where it's like, yes, you can still give them treats and you can have that bond, because I think it's important to give your pets treats. Like, that's part of the human animal bond, but maybe find a diet that has less calories in it.
Yes.
So,
well, and Remy really loves blueberries.
Yeah.
Those are one of her favorites, and that's
amazing.
That's a good treat.
Perfect.
Doesn't count anything.
Exactly.
She also gets carrots, but she won't eat, the one food that she won't eat, which is really funny. Not that I ever wanted to give her. It's only if it falls on the floor, but lettuce.
Oh, really? Not a lettuce.
She will lick it and just
kind of that situation. Yeah.
But everything else that she can possibly find, it could be a dirt crumb and she would eat it. But lettuce, no.
She's like, I'm not a rabbit.
No, she's like not the epitome of health and wellness. I may work out and I eat good, but like, don't feed me greens.
Honestly, Remy, I'm right there with you, sister. Give me steak and potatoes. I get it.
Oh man. Okay. I always love to end this on a piece of advice or motivation or inspiration or something to talk about that we didn't get to that maybe you want to talk about? It can be whatever. The floor is yours.
Okay. Let me think about this. I think what I would say is, it's probably not even veterinary related, but if you feel like you're in a position in life where, you know, whether it's your job or, you know, your relationship, if you are questioning where you're at, if you don't feel 100% committed, if you're like, wait, this is not what I signed up for, I would say, don't be afraid to make a change. Don't be afraid to do something really scary to get you to that next chapter. It may feel like you're at the bottom of Everest, but one foot in front of the other, and soon enough you'll look back and you'll be at the top of the mountain. So I think that's one really big thing I've learned in this last year of, you know, leaving my practices and starting this concierge business. It seemed really scary and daunting at the time, but we only get one life. And so, you know, if you're not willing to do hard things, you can't get to the next best chapter. So that would be my advice.
Do you want to end that? Because that was such a good place to end on, but it did lead me to a question.
Yeah.
You are an entrepreneur, and like this is also a side of this, of you starting a business and doing things that are difficult. Like, has there been things along the way that have been hard for you? And maybe there's specific moments or maybe just overarching, but what has that experience been like? Because I think a lot of people would love to chase dreams and love to be an entrepreneur.
It is not easy. Let me just tell you that. Like, there are sleepless nights. Is anyone going to sign up for this? Am I charging too much? Is this a crazy idea? Like, you will doubt yourself. You will question yourself. It's not like oh my gosh, I have this amazing idea and everyone signed up and it worked beautifully. Like, no, there were months where my phone didn't ring once. So you really have to, you know, you have to believe in yourself. You have to believe in whatever it is that you're creating, and just know that there will be challenges along the way. You will doubt yourself, but ultimately you just have to, like I said, one foot in front of the other.
Well, then even better to end on.
Yeah.
That was perfect. And Dr. Josie has a podcast, like I mentioned at the beginning, in the vet's office. Check that out. A new season, I believe, is coming.
It's coming. It's in the works.
Sometime soon. And just reach out to her on Instagram for your concierge if you decide to accept more patients.
I'm like, actually, please don't. I'm just kidding.
Never mind.
But, no, please do. I think at some point we'll be bringing on another vet. I can't spill too much tea yet, but yeah, definitely reach out to me. It's at Dr. Josie Vet.
Love that. Well, thank you for joining me. Thanks for talking about my pets. Thanks for talking about animal and human connection, all the things.
Oh, you're welcome. Thanks for having me.